are seeing already some early differences in results that are, some are as expected, that are genetically based. We do know that DLP4 heterozygote is an elevated risk as compared to some of the other haplotypes we're studying. And we also see some international differences, particularly in the area of celiac disorders among 2-year-olds. And we're noticing that we're seeing some geographic differences. Some of that may be practice patterns. As you know, in Europe, people are a bit more sensitive to looking at celiac disease and diagnosing it. In the U.S., people are a little less so in terms of the aggressiveness in diagnosing that. So we're beginning to sort out some of these differences at this moment. Another study in which that is based here is a study that looks at as an intervention trial where we're actually looking at the effect of cow's milk exposure in newborns as part of their formula to see whether that contributes to diabetes risk. Here the hypothesis is that in newborns the gut is somewhat leaky, that intact proteins can transcend the gut, and the immune system can respond to that and place these children at increased risk. This is a randomized controlled trial that's being done in all the countries listed on the bottom right here, including some centers in the U.S. Now, there were no children accrued to the study in Florida, unfortunately. Our accrual period was before we actually expanded the diabetes center. But we are following 2,000 babies and looking at their risk. Some early results that I can show you are related to diet and immune response to cow's milk. And so here I've just put on some slides just to give you a rough idea that if we eliminate cow's milk, that is, this is a period of time in which mothers are only breastfeeding. That's the only food these children are getting. There's no intact protein. They're not getting cereals or rice in this early stage in the first few months. That indeed we're able to prevent cow's milk-related antibodies. And you wonder, how prevalent is that? We do know that cow's milk-related antibodies are correlated to islet cell antibodies, which would suggest to us increased risk for diabetes. And we can see that before we actually expose an infant to intact protein through cow's milk, we can actually see that there are very few anti-antibodies that arise. Now, once we do expose them, and that's the dotted lines, I hope that shows up. Once we do expose them to cow's milk, we see a rapid increase in the markers that show that they're antibodies to cow's milk. So we do know that, indeed, in this trial, we can, in fact, reduce the incidence of cow's milk-related antibodies, and these data are clear and show results in the first 6 months of life, which is primarily when breastfeeding, exclusive breastfeeding is occurring, and we see limited exposure to foods containing intact protein. Here, once that protein is introduced in these genetically susceptible individuals, children, that in fact we do see a rise in cow's milk antibodies. Now, of course, what we don't know really is whether by eliminating that, we actually can eliminate islet cell antibodies and subsequent risk to diabetes. But we're not really sure of that. We don't know because, in general, when we introduce foods, even after this intervention period, the intervention extends for the first 8 months of life. But after that, we can see that antibodies rise. And you can see on these slides that as these children get older, 9 months, 12 months, and beyond, they all develop antibodies. So whether we can make a difference by changing this early nutritional intake in the first 6 to 8 months of life, whether that's sufficient to induce some protection, we're not really sure. That's the focus of this study, to see whether that can occur. The study will continue. It's got about 8 more years to go. We'll look at endpoints through the first 10 years of life in terms of development of islet cell antibodies and diabetes. Now, TrialNet is also being used in another study. Now, this one is looking at omega-3 fatty acids, and providing dietary supplements to moms and to babies to increase their DHA levels, with the hypothesis that by increasing that we can reduce the inflammatory process, because as you may remember, a lot of diabetes, type 1 diabetes, is thought to be somewhat inflammatory in nature, with beta cell insulitis, and you can see the activation of the T cells, which lead to beta cell destruction. So this is a study that we think is hypothesized that omega-3 fatty acids would act as an anti-inflammatory, and so the pilot here is to see whether, in fact, by giving these dietary supplements, we can actually increase the levels of DHA and decrease one of the biomarkers for inflammation, and that's IL-1, one of the cytokines. This is the hypothesis, and how it was laid out. It was first found in the DAISY study that was done at the Barbara-Davis Center, and then subsequently adopted by TrialNet. And this study has closed to accrual, and the initial results will be reported in October at the TrialNet meeting that's about to come out. So we're anxious to look at those results, see what impact, whether dietary intervention as suggested can improve or increase DHA levels, and then what impact have we had.